Hi all, I'm Dr.Diviya, your gynecologist. Today we are going to discuss about gestational diabetes mellitus, commonly called as GDM. In this condition, a normal, healthy pregnant woman who's never been diabetic during her lifetime suddenly develop features of diabetes mellitus during pregnancy. There are various risk factors for GDM. We, being Indian by origin, by itself makes every single pregnant woman in India come under the high risk category. In addition to this, if there is presence of PCOS or there is a history of diabetes in father or mother or obesity, all these kind of factors kinds of adds on to one's risk of developing GDM. The condition is quite common in our part of the world, and sadly, India is known as the diabetic capital. So it is important that every pregnant mother has a basic understanding about this condition. So in this video, I will be talking about three important things. One, regarding the diagnosis. Two, regarding how to manage the condition. And three, regarding the delivery options for a GDM mother. So how exactly is this condition diagnosed? As I told you before, this condition develops during the course of pregnancy. So the initial blood test which you do in the 1 or 2nd month of your pregnancy will show normal blood sugar values. And this condition is expected to arise or surface itself only around the 5th month of pregnancy. Hence, we offer a screening test for GDM for every pregnant woman around 20 to 24 weeks of pregnancy. In this test, a fasting blood sample will be drawn. You will be asked to drink some glucose water, following which again blood will be drawn. Looking at these blood sugar values, your doctor will be able to diagnose whether you've already developed GDM or if you are having a risk of developing GDM in this particular pregnancy. It is very important for every pregnant woman to undergo this screening test because not only it diagnoses the condition, but it also identifies women who can develop GDM in the present pregnancy. By knowing this information, one can postpone or even prevent the occurrence of GDM effectively. Once you are diagnosed with GDM, the next important thing is to control your blood sugars. Because if the blood sugars go uncontrolled, the chance of complications increases. So it is important to have very good blood sugar control. And what plays the major role in having good control is nothing other than your diet. So you need to follow a very good diet protocol which is formulated for you by your dietitian with the help of your doctor. So if your sugars are only borderly elevated and it is only a mild disturbance in your blood sugar, a very good diet by itself can achieve control in 80% of the cases. In patients who do not have control only with diet, we do offer oral medications. And insulin is reserved for those patients who are having very high blood sugars or in patients who are having a lot of fluctuation in blood sugars or in patients who are expecting delivery within a short time from the diagnosis. So only in these kind of situations we give insulin. So however, whichever mode of treatment is offered to you, the key net result that we aim at is having a good sugar control. The next thing that I want to talk to you about is regarding your delivery options. GDM is not an indication for cesarean, which means every GDM mother can undergo labor and can achieve successful vaginal birth. The only contraindication, the only condition when we say no for a vaginal delivery in a GDM mother is when there is a suspicion of macrosomia. Macrosomia is nothing but big babies. So, when your doctor is suspecting you to be carrying a baby which is more than 3.5 kilos, that is the only time we discourage you undergoing a vaginal birth. This is because a combination of GDM and macrosomia can lead to what is called as shoulder dystocia, which means the head of the baby will deliver, but the shoulder and the body can get stuck. And this is a dreaded complication. So, to prevent this, you can undergo a growth scan closer to your delivery date, somewhere between 34 to 36 weeks. So, this scan will give you an estimated fetal weight. So, if your scan shows a weight of 3.5 or anything more, it is advisable not to undergo a trial for vaginal birth and to go in for an elective cesarean section. So, this is the only condition wherein we discourage vaginal birth in a GDM mother. All that is required is prompt screening, timely diagnosis of the condition, good blood sugar control, which will thereby prevent big babies. And once this is achieved successfully, every mother, in spite of having GDM, can achieve a vaginal birth successfully. Thank you. Bye.